my feel-good breakfast show.
Welcome back, Kit, to Feel Good Breakfast Show. It's Tuesday morning. Yeah, we're having a good laugh, but this is no laughing matter indeed. From the 19th until the 25th of September, we witness World Retina Week, and the aim of this is to bring awareness to one of the most important organs in our body, the eye. So today we take a closer look at those little globes in your skull without which you wouldn't be able to see our beautiful faces on your TV screen. And we're joined, of course, once again by our resident Dr. Darren Green. And the question we ask is, are you suffering from any eyesight problems? This is your opportunity to call us on 021 430 9881. So let's see what this is all about. Dr. Green.
Indeed. Good morning.
Morning. Let's talk about the retina. Like, where is it based? What is its function?
Yeah, a lot of people have heard the word, but they don't understand where it is. The coloured part of the eye is the iris, and then you have the black circle, which is the pupil, which can adjust in size according to day or night. The retina lines the eye all the way at the back. So if we look at that part over there,
That yellow part.
yes, the thin yellow part. It's actually a transparent layer that covers 65% of the inner lining, basically, of the space once you shed light through the pupil. And that's 65%. And then the center part of it is called the macula, which leads into the optic nerve. So you need, obviously, all the light to be absorbed in that transparent yellow layer, to be directed via nerve signals into that optic nerve, which then sends all that coded electric signal to your brain, which enables you to actually view and see the image that you've seen.
I seriously wish...
so quickly.
Yeah, I seriously wish you were my biology teacher at school. I would have found the subject a lot more interesting. I mean, there's so much fascination about it. Apparently, we actually see upside down and your eye converts the image right side up. But how do we know that the world isn't really upside down and we're the ones stuck to the roof of the world?
Gravity exists.
You know what I'm saying?
Yeah, the question is the way the light's transmitted through the lens, basically. And how it happens is the light waves are bent through an optic-shaped lens, an elliptical-shaped lens. And it's got to do with the top of the image hits the bottom of the lens first, and then it's inverted, shooting it onto the back of the eye. It's just got to do with the wavelengths.
Yes.
And when the light enters a curved surface, how the light rays are actually bent. Remember the prisms we used to do at school?
Yes.
When getting the rainbow-coloured spectrum through a prism?
Yes.
Well, the same thing happens with obviously an elliptical-shaped lens, and then you have to understand the physics behind the direction of that light.
Actually, it's true. We do see upside down.
Amazing.
Well, you showed us earlier that the retina covers about 65% of the eye. What happens when we go into the sunlight without sunglasses?
Yeah, so you can imagine if you're having a greatly concentrated, bright light entering, obviously, through the aperture, which is the pupil, that black hole, which in cats, obviously, you'd know at night time, they obviously expand quite dramatically to allow more light in, to absorb and to get a clearer picture of what you're seeing, or in a fight-or-flight circumstance to identify a place to escape to if you're not going to conquer your enemy or the threat. So if that bright light hits the eye and the retina, obviously, all at once, it could be quite overwhelming.
Yes.
Bit of an overstimulation of the sense, of the light sense.
Yeah. Is there a quick way of explaining why sometimes when you're asleep at night you see like little spots of light, like little stars? But it's completely dark. You've got your eyes closed. Is that normal?
Yeah, so obviously you still have some of the cells that have absorbed light that are still firing, and then it settles down as obviously after time goes on. If you coincidentally, if you look through your eyelid at a bright light, you'll see it's red as well.
Yes.
Because the light continues to permeate through the skin even while you sleep. That's the importance of people that have insomnia, to ensure that the room is completely dark. Because that electric signal and wavelength is relayed to the brain and affects a gland called the pineal gland, which releases melatonin.
Very interesting. Very interesting.
I see. Dr.
Well, we're asking you the question. If you have a problem with your eyesight, or you have a comment or a question for Dr. Darren Green, give us a call. Our number is 021 430 9881. We'll be back with the doctor shortly.
It's my feel-good breakfast show.
All right, we're back again with Dr. Darren Green. We're talking all about eye health because this is World Retina Week from the 19th until the 25th of September. And while we investigate this further, I had a question to ask Dr. Darren right now. I think I may have stumped the doctor. What is it true that you cannot sneeze with your eyes open lest they pop out?
Look, you can try, but I do know it increases the pressure in the brain because of the surrounding fluid and the intracranial pressure when you cough and when you do sneeze. That's why sometimes when you have a headache or a sinus headache and you cough, it goes like, expansively painful. So
I only read it on like a did you know fact. Please do not try this at home. Do not try it at home.
Do not try it at home. Well, we asked you the question, are you suffering from eyesight problems? Our lines are open. Right now we have Gillian from Durban on the line. Good morning.
Good morning.
What's your comments or question for Dr. Darren Green?
I just want to know if you can tell me about this, anything I can do about my eyes. I've got thyroid. I've had the thyroid up at age 15. Last year I had pink eye and I changed my pills at the same time, and it played havoc with my thyroid. I now can't read properly. I can't do anything where I keep my eyes steady on one spot. You know, I can see to drive and things like that where my eyes are moving all the time.
All right. Thank you so much, Gillian, for sharing with us, and let's have the doctor.
She mentions quite a few things. She mentions thyroid problems.
Yes.
The problem with the thyroid gland is it causes exophthalmos, which means the eye actually looks like it's popping out. In other words, it enlarges and moves forward. It protrudes in the front part of the orbit, and you can see the one eye actually looks like it's actually protruding, or both eyes. She also then mentions that she has difficulty focusing when she reads. It's actually jumping around. And one of those conditions are caused by nystagmus. Nystagmus is a condition where the focusing or the movement of the eye is abnormal due to the coordinating mechanisms, which are controlled by different parts of the brain, synchronizing the muscles of the eye to move smoothly and to stay still and focus on one spot. So the problem could be related to many different things, either on a local level on the eyes, but particularly also looking at the brain and particularly the cerebellum. There are many different causes that can cause nystagmus, including conditions of the ear.
Yeah.
So it would definitely be recommended that if her eyes are jumping during the focusing on something that she sees, an ophthalmologist first,
Yes.
and that he might even refer to a neurologist.
Okay. Gillian, thank you so much for that call. We really do appreciate it. And while we're talking about retina conditions,
Yes.
what are some of the more severe ones that we talk about? Retinal detachment. It sounds super painful.
That's a big one, and I think a lot of people don't know about it. So as I said, the retina is a transparent membrane that lines the inner part of the eye.
So right now we're looking at that red.
The
the
orange.
Oh, the orange,
above
excuse
the
me,
red.
okay.
And you can see that part, it's bulging. It's actually pulling away from the red. The red layer is the beautiful blood supply to the retina because it needs oxygen, it needs nutrients to function, and the highly skilled cells that it comprises need that sustenance. So what happens is with aging, that orange, or the yellow layer really gets thinner and thinner. So your likelihood of it pulling away from that wall of blood vessels gets higher with age and with smoking and with certain genetics. So what we need to obviously recognize is what are the symptoms when you develop a retinal detachment, because something can be done about it. If you deal with it early, they can actually reattach it in the form of suturing and so forth as well. So yeah, important to recognize early signs.
Okay. Well, we'll be talking to Dr. Darren Green about the symptoms, way to possibly reverse it a little bit shortly. But our lines are open. That number is 021 430 9881. If you have an eyesight problem, you've got a comment or a question, do let us know.
It's my feel-good breakfast show.
Welcome back to your Tuesday morning. This is your Feel Good Breakfast show. We're talking all about your eye health because it is World Retina Week. And we have Cindy on the line who'd like to give us a question or a comment to Dr. Darren Green. Hello, Cindy.
Hello.
Morning.
Great to have you. What's your question or comment?
So my question is, a couple of years ago, I had an accident that happened with my eye. One of a elastic had shot on it. And then now I have these things that's called eye floaters at the back of my right eye. And what happens is whenever I drive or I look left and right, it sort of is in the way of my vision. It's almost like it's a mucus of some sort. I want to know, where can I have this removed in Cape Town, please?
Okay.
Great question. Thank you so much for that.
So floaters specifically are exactly that. They're little blotches that float across your vision. They can actually move a little bit. That could be early signs of retinal detachment, which are quite important.
Yes.
You also could have, on the other hand, particles circulating in the vitreous humor, which is the actual fluid part that runs from the front of the eye to the back of the eye. If you have any particles that are moving around in there. So very different. You've got to look at the total package of the clinical picture. Whether there's associated trauma, which she mentions, with an elastic band, whether there is obviously things like a curtain or a veil coming over the eye. Typically we describe, it's almost like a fly sitting in your visual field, moving around. As part of the warning signs, the early warning signs of a retinal detachment. And that's worth certainly seeing an ophthalmologist for, because what they can do is focus all the way at the back, look at the retina, and then obviously examine the entire area. I mentioned that. But if they can't, then they'll even do a sonar on the eye if your symptoms can't be explained by what they're seeing at the back, to have a look in detail at the back of the eye. So definitely worth a look, and certainly she shouldn't leave it.
Yeah.
And then, of course, you know, you do get other things that can cause patches in your vision. Even migraines give you what's called visual scintillations, which are basically where you have the blurry patterns, or you have things coming in and out of focus, etc. So very important to understand that. And the diabetics particularly need to be extremely mindful of the fact that when they have intermittent blurring of the eyes or visual disturbance, to get it checked out ASAP.
Yeah. Sorry.
Yeah.
I'll go. A bit of off-topic question. Just the second part of her question about where she can get it removed. Can you go to any general hospital and find an ophthalmologist there who can help you with something
your
like
GP
this?
should be able to refer you
Okay.
with a proper referral letter to an ophthalmologist, and then obviously have it checked out. You also get a condition that's common in South Africans called pterygium, where you have a little membrane that grows medially from the nose side over towards the eye and actually covers the top of the cornea in sun-exposed areas and people. So what we need then, obviously, they actually can remove that little membrane and take it off completely if it affects your visual field.
Okay.
So certainly she needs definitely to consult an ophthalmologist.
Wow, so much insight and eye-opening information.
Yes, well, we're going to have more with Dr. Darren Green. In fact, I want to know whether carrots really help your eyesight. You know, growing up, we got encouraged to eat our carrots. But if you've got a comment or a question regarding your eyesight, it is World Retina Week. We've got Dr. Darren Green here for your comments and questions. Our lines are also open. That number is 021 430 9881.
It's my feel-good breakfast show.
All right, listen up. We're back here again with Dr. Darren Green. We're talking all about your eyes' health. It is World Retina Week from the 19th until the 25th of September to create awareness around the importance of the most important organ in your body, the eye.
That's right. Well, we got a caller online. Mrs. Kuhn, good morning from Fishhook. Morning, are you there?
Hi, yes, I'm here.
Yes,
What's your
ma'am.
comment or question for Dr. Darren Green?
I'd just like to know, I've got to go for laser treatments on my eye, my right eye. And I'd like to know what does it entail? Will it affect the eye or what?
That's a great question, because I think far too often those things aren't explained, what it entails, and so it causes a lot of anxiety in a patient. Thank you so much for that, Mrs.
Good question, and I think a lot of people contemplate whether they need to go for laser treatment for their lenses particularly. So you have different defects of the lens. The shape of the lens can change with age and with time. You also could have obviously clouding of the lens, which you then develop cataracts, for example. But the laser surgery often involves the shape of the lens and surgery to adjust that. And you even have a lens replacement done that then occurs, so that you can get away without wearing contacts. So a lot of people either have to wear spectacles or glasses or contacts, and I think that the surgery has come a long way. I think always speak to people that have had the op before you. Get some good advice. Speak about the recovery period. Speak about the risks involved. Speak about the success rate and so
How
forth.
long the procedure
Correct.
itself is.
Correct. And what to expect realistically afterwards, to get all those questions out and ask your practitioner, your ophthalmologist, exactly, you know, what is, let him depict to you and show you what they're going to be doing with the laser therapy, because it's not without risk, obviously. Every eye surgery is with risk, and that needs to be explained in detail.
Okay, it's good to know. Well, doctor, I really want to know how much does carrots affect your eyesight?
Yeah, Bugs Bunny obviously sees fantastically, but generally vitamin A, beta-carotene is the magic ingredient. And a lot of people suffer from night blindness. When you can't drive at night, you just can't see well at nighttime. That's xenophthalmia, and that's often a result of having too little beta-carotene or vitamin A in your diet. Remember, the retina that we've discussed at length has specialized cells that require not only vitamin A, but other vitamins and nutrients too, to perform their function. They're highly specialized. They're 3 layers of cells, and they need good nutrition.
Yeah.
So yes, carrots certainly affect the clarity of your vision, particularly at nighttime.
Yeah. Talk to us about the age that we live in terms of us being face-to-face with devices and cell phones and
Bright
this and
lights,
that.
yeah.
Bright lights the whole time, and how that, you know, kind of contributes to the degeneration of your eyesight over time. And then also just share some of your top eye... good eye health tips, yes.
Yeah, so I think, you know, certainly technology, tablets, spending time in front of the television is also the LED lights, for example, at nighttime, stimulate those rods and cone cells in the retinal layer, causing buzz and activity in the brain that carries on even when you close your eyes and try and sleep. Be aware of the fact that bright light and the effect of lightning helps, it has an effect on your relaxation techniques, also in terms of your stress levels as well. So decrease that an hour and a half before bedtime. Try and get to a place where you start desensitizing and toning things down at home. Maybe use some candlelight as in the old days. So look at that. And then the eye health tips, we'd look at things like protecting your eyes from the sun, bright light, glaring light, off the snow, even for those that go skiing and water sports. Be aware of that. And then, of course, your diet plays a major role, and so does exercise, to keep those blood vessels patent. Early detection of any blood vessel issues can help save your eye.
Thank you very much, Dr. Green. Always looking forward to seeing you next week again for our next health chat. And thank you for all our callers with your comments and questions. I still wanted to ask what happens when somebody does this, and then you go, why do they do that? It's weird.